Hey, what's up, guys? Spangeth here. So today I'm just gonna do a short video today. This week's been pretty rough for me, and that's mostly what I'll be talking about. So on Sunday, I thought I got sick because I had like a very, very low grade fever, um, and I was having some pain in my stomach, abdominal area, and I was like, okay, maybe kind of cold because I get sick like at a drop of a hat, and so then I just took it easy and didn't really play or do anything, and then Monday it was weird. I then the fever kind of went down a little bit, but then I started feeling like chest pain and shortness of breath and all that, and so I was like, oh, great. Started to worry. Is it like COVID or something like that? And so actually, I reached out to my primary doctor and talked to her a little bit about it. Had an appointment over Zoom with her and talked to her about that. And the main reason why I saw her in the first place was I've been having these like temperature changes where I'd be super freezing cold, wearing sweatshirt jackets and socks all day, and then all of a sudden I get like what feels like a hot flash, and then I'm like leveled out, and then I'm freezing cold, and I'm hot, and it just kept cycling every day for the last couple of months, and it's obviously not normal for me. And so I worried about that, and I was just like, I don't know what that was all about, and so I saw the point was for her originally for that, and so she actually had me do a bunch of blood work. And only thing that came back so far was thyroid, which is normal, so that's good. But anyways, I kind of worried about the COVID, and I brought it up with her, and so I got it tested, which thankfully came back negative. But the pain in my abdominal stomach area just like persisted. It wasn't really anything until today that pain kind of dissipated, and I kept thinking, is it like kidney stone? Is it kidney infection? And I talked to my two good buddies about it, and getting their opinions and whatnot. And I have another appointment with my primary, this time in person, on Tuesday, to kind of go over that. Of course, now actually it probably won't be hurting by then, but what I ended up eventually deducing with what is going on with the pain down there is I think almost for sure, I'm like 99% sure, I think what's going on is so I have small fiber neuropathy, and it's an autoimmune disease, and I've been taking pentotoxifylline, which is just a pill medication, and it seemed to work for basically all of last year minus like December. And it didn't dawn on me until I like put together the hot and cold temperature changes, this pain in my stomach, and just a few, the muscle wasting in my hand that I've talked about, the nerve pain and problem in the left hand, which is now starting to go on the right, and a couple of other things. And I put it all together, and if you really look up small fiber neuropathy, it talks about all these symptoms. And there's a couple other that I didn't have, but like 90% of the symptoms, I was like right there. And so it just dawned on me, like, I bet my hormone levels are going to be normal, unless it messes with your hormone levels. I don't think so. But I would be surprised if they didn't come back to normal at this point, because I'm thinking that's what's going on, is that my neuropathy is now no longer being managed by the pill, and or it's getting worse. The downside is, though, even if that is the case, the downside is, as far as I can understand, and talking to people who've had this before, or have this, I should say, is that basically the treatment I would have to go up to is either methotrexate, which, if you're not sure what that is, it's basically a pill, but it's a low-grade version of chemotherapy. That's literally what it is. And my sister was on that for years, and she hated it. My mom was on it for a hot minute, and she hated that. Everyone I've ever talked to about it says it's like the worst thing ever. So I don't want that as an option. But the other option that I know of is a biological, like an injection or IVIG or something of that nature, which my sister currently takes and she's more happy with. But again, I don't know how my body will react to things. I don't know. I think there was a third option. I can't remember at the top of my head right now because, whatnot. Yeah, so that's the downside if this is truly my neuropathy. The only other thing I worry about too is because I forget what testing it was I had done. I think it was the beginning of last year or the end of the year before that, where I had these tests done through my pain specialist, and the test basically came back. The only one I can remember offhand, and that's like a fun paperwork, is that she said I was at a very high risk of developing autonomic neuropathy. And for those of you who don't know what that is, it's essentially your motor function. So everything that controls your movement, everything, the automated motor functions that your body does without you having to think about it. That's what that is. And to get that is not good at all, because you can lose functionality of your arms, your whole body, everything, and I hope that's not what's going on, because that would be very unpleasant. And the treatment, I don't remember it being very pleasant either. But nonetheless, either way, I think it's my neuropathy, either the one I have or a new one. So I guess Tuesday I'll find out more from my general practitioner when I talk to her about it. I'm also going to try to get to see if she will recommend me a new rheumatologist, refer me to one. Because while, the lady I have, she's sweet and everything, but like I said in the past few days, she doesn't have Sjogren's, and actually I just got retested for it, and again it was negative. But it's like rheumatoid arthritis. If it's in a dormant phase, it's going to test negative. If it's in a non-dormant phase, we'll test positive. So I'm going to see if I can get a new rheumatologist, and then kind of talk to her about what's going on with the neuropathy, and see if she can find me somebody to deal with that too, another doctor, because while my pain specialist is treating it right now, I mean, they primarily, like they say it's every appointment, we primarily see you for your back problems, right? I'm like, well, I guess, but I mean, it's more than that at this point. But even still, I'm not actually pleased with them, with everything that I have to deal with to get things done and results and treatment. So I'm just going to try to see if there's other doctors I can see to help me with things. Be willing to try treatments and see, whatnot. So I hope that all goes well. I honestly, as much as I don't want it to be the neuropathy, it's really the only thing that I think it can be. And in a way, it would be good if it is, because then at least I understand what's going on, and then we can take steps into improving it and helping it, and increasing that quality of life. And I know new medications is always a struggle, because you have to find one that works, and where the side effects there are tolerable, or there's little side effects, or if there are side effects, but the drug's working, then it's like, oh, maybe you took another medicine to try to help those side effects, yada yada yada. It's not fun. The other thing I'm going to bring up with my primary doctor that I've been dealing with over the last month or so is my heart has been feeling like it's having, I don't know if it's palpitations or it's beating extra fast or skipping. I'm not quite sure, but I constantly, even now as I'm talking, I can feel this odd sensation, like it's either like double pulsing or it's skipping. I don't know, it's something's going on there that's new. And I have mitral valve prolapse. I don't know if I've ever talked about that, but I'll talk about that next week. I'll bring that up, and of course updates about um, my my general doctor's appointment and how that goes. And um, and I also won't be getting my nerve burn. I think it was next week. I had to push it back 2 more weeks, so I won't know for 2 more weeks if the nerve burn takes, because I talked about how they think my upper spine might be twisting or rotating. So I'll update you on that as I know, and whatnot. My hand, just a quick little update. I mean, I'm doing everything they're telling me to do. I keep trying to wear the hand brace as often as possible, but sometimes it makes it worse. Sometimes it makes it better. The splint at night, I can still only tolerate for so long. It's not comfortable, and it doesn't always feel like it works, or it puts my shoulder in an awkward spot, and so it dislocates that, and it's a whole nother issue. So yeah, kind of not really a good week this week for me. So yeah, just trying to hang in there, and just I started documenting things. And I know I haven't been the best at writing everything down, every symptom, or interaction or things like that. So recently I bought this printout, medical records kit thing, and I'll be assembling that over the next couple days and filling it all out. And I'm just going to be using that from now on, just so I don't forget things. Like I totally forgot this one medicine that I was allergic to or had a reaction to, and I know I need to tell my doctors about it, and just because I totally spaced it because my memory sucks. So yeah, I'm just trying to do what I can to get to at least a stable spot, because it seems like something's after something after something after something over the last year is just nonstop, and so it's frustrating, it's depressing, it's just not pleasant. So but yeah, I'm doing what I can, and I'll keep you guys all updated on everything. And I'm sorry this video is a little short, but like I said, I'm just having a real tough week this week, and I'm just trying to recuperate and find some answers and whatnot. And so I thank you guys for watching this video. Please, as always, like and subscribe, and check out any other videos that I have. I thank all of you. I love all of you. I hope you guys, can find your voice, your advocacy, that you can get the health and get the doctors and anything that you might need. That you can push doctors to help you, or you push yourself to help you, or you have friends or family to turn to. You're welcome to come to my channel in the comments or whatnot, and reach out to me, and feel free to leave any comments or questions you might have for me. I thank you and love you all, and I'll see you guys next time.